Okay, so what I'd like to go through is the procedure that I would use for the lower thoracic or lumbar spine, or even through into the sacroiliac joint, a treatment for possibly facet joint problems, any soft tissue, muscular, tendon, ligament, fascial problems, possibly post-kissing spine surgery. Then the same procedure can be used for multiple different applications. So we have the return plate in place underneath the sternum. We want the return plate to be in the opposite side of the body to the area we're treating. So we want to think about the current going from one electrode back to the return plate, and the area you want to treat to be in between that. So a little bit of water on top of the hair, then some gel on the electrode. So I'm going to use capacitive first. So we'll do a 20-minute procedure. So some gel on here, and then we can apply this. I would tend to, rather than using the hand-held part, pop your hand on the electrode, and then you can feel the heat coming from the electrode itself. And depending on the size of the area you want to treat, you can just treat locally, for if it's a small area, or you can extend it as far back as you'd like to go. So for lower thoracic, just keep moving the electrode around. The settings I'm using here is 30%, and I would just start with the capacitive for around about 5 minutes. So I tend to do about a quarter of the time, treatment time, with a capacitive, and then 3/4 with a resistive electrode. So just don't need to go too quickly, just move around at a nice gentle speed. If you start to dry out, you can just take the hand off, pop some more gel on, and you can just continue. So every time you break the contact, the time will stop, so you don't have to worry about keeping an eye on the time. And you can work as far back, as bigger area as you like. So if you want to go down into the lumbar area, and then alternatively, if we were going to look at a sacroiliac problem, then if you kind of try and visualize where the sacroiliac joint is in here and think about the direction down to that return plate, then we can pop the electrode on and just work this area. So you want to spend around about 5 minutes with this protocol with the capacitive electrode on the area you want to treat, and then you can swap to the resisted electrode and repeat the procedure. So if we do that, we'll just disconnect the capacitive, and then just simply clip the resistive one in, and again with more gel. Thank you. And then back onto the same area. Time will continue, and you can just very simply work around this area. And if you just keep an eye on the heat with either hand that you're using, or you can follow with the other hand, and you can keep an eye on the heat being produced. And then just work around that for the rest of your time that you want to do.